Today I'm going to teach you why most back pain and sciatica rehab fails and 3 things to do instead without drugs, injections, surgery, or endless doctor's appointments. I'm Dr. Anthony Davis. I had chronic pain for over a decade. I'm going to show you how I fixed my pain and helped hundreds of other people to do the same. So I know that if you're watching this video, you've probably already tried physical therapy, maybe things like chiropractic adjustment or massage, injections, medication. Maybe you've done a lot of core stability exercises or tried to fix your posture, tried to fix your muscle imbalances or alignment-based exercises. And it's not working, right? Otherwise, you wouldn't be watching this video. So if we look at the research, we're going to find out why those things are not working for you. So let's take an evidence-based approach. Let's dive in. So first of all, why does standard treatment fail for some people? Now, obviously it works for some people, but if you're watching this, it didn't work for you. Why might it not have worked for you? Well, it's pretty straightforward. Most of the available treatments are just short-term pain relief, right? Core stability says, hey, let's just stop using the area that hurts. That's not actually a long-term solution. A lot of the stretches and hands-on treatment, changing your posture, muscle imbalances, these things are just distractions, essentially. Hands-on treatments like decompression, traction, TENS, ultrasound, heat, ice, these are just short-term relief. They don't do anything to your body long-term. They just offer short-term relief. The same thing with medications. Injections, nerve ablations, and even surgery really is short-term relief if you go back to the same lifestyle that got you into this in the first place. So what should we do instead? So in this video, I'm going to show you how to fix chronic pain. It's going to be very straightforward. Number 1, we're going to talk about what causes pain. Number 2, how to calm things down and get pain relief. And number 3, how to build resilience and bulletproof your back. So first of all, let's dig into the acute pain versus chronic pain. So acute pain usually heals on its own, right? So most episodes of back pain, even flare-ups of chronic pain, will usually go away or go back to baseline somewhat quickly within a matter of weeks or months. But chronic pain is the main issue. It just never seems to go away for some people. And this is why we have a chronic pain epidemic in the world. The world really does have a chronic pain epidemic. We see this. Research shows that chronic pain is the number 1 cause of disability in the entire world. Now, I want to be clear about our medical system. We could, I'm sure, between you and I, talk badly about the medical system all day, but the medical system is really good at life-saving emergency care in many cases, not always, but as far as the last 100 years, people are surviving things that they would have died from, 200, 500, 1,000 years ago. So life-saving emergency care, we're doing pretty good. But, and I know that, by the way, I know that because I nearly died. I was dealing with chronic pain and other chronic symptoms. And I nearly died because I was drinking myself out of my symptoms, and I ended up in the hospital for alcohol poisoning, and firefighters literally came and saved my life, carried me out in a stretcher and saved my life. So I know how good the emergency system can be, but chronic symptoms, they suck, right? So after I went through a hell of a ride, I got my doctorate. I'm a doctor of chiropractic, have my master's in exercise science. I teach college anatomy and physiology, and I have a ton of other certifications in movement and yoga and mindfulness, meditation, rehabilitation. But the important thing here is yeah, we're good with the emergency care, but chronic pain, our medical system sucks, right? You just take a number, you get in line, you try some core stability at physical therapy. If that doesn't work, they give you, NSAIDs or muscle relaxers or gabapentin. If that doesn't really work, they send you for injections or nerve ablations. And whether that works or not, it's surgery, right? That's kind of the only option that you really have. So what happens with pain is, right, like I said, most acute pain actually just gets better with time, even if you do nothing, right? This is what the trajectory of pain looks like. This mark here is 3 months. So most pain with most people is going to get much, much better within the 3-month time period. After that, though, it's tough. But because most pain, even if you do nothing, gets better in 3 months, this is why everything seems like it works during acute episodes, right? You could do chiropractic or acupuncture or massage or traction or decompression, whatever. If you do it during this acute window, during a flare-up, it's going to seem like it works because you could have just done nothing and it would have gotten better on its own. But after this 3-month time period, then it seems like the opposite. It feels like nothing works no matter what you do. It doesn't matter how much dry needling or massage or chiropractic adjustments or core stability exercises you do, or even injections or medications. It just seems like it's never getting better. That's why chronic pain is so difficult. Now, in reality, that curve that I showed you is kind of made up of the average of two different groups, right? The acute pain group that pretty much just gets better and the pain goes away. And then the chronic pain group, which you might have a severe flare-up, but even though it does get a little better, it still stays pretty significantly impacting your life for quite a long time. And so this is why we need to understand the difference between acute pain and chronic pain. And we need to understand why acute pain becomes chronic for some people, but not other, right? Let me just show you the actual graphs and the real research. Here is acute pain, and we can see that it's persisting, but pretty much gone after a year. Whereas the chronic pain, there's not really this steep drop off. It's a gradual decline over time. And even at the year mark, it's still, somewhat significant for most people, right? Then if we look at disability, we see the same thing. We see acute pain. People are having to take off work. They really can't do daily activities. They're disabled. For some people, they're even in a wheelchair. But for most people, it gets better very, very quickly. And then it kind of levels off, and over a year, it's pretty much better. But with disability, chronic pain, look at this, it almost doesn't improve over time for the average person. Or if it does, it's barely improving. So we got a real issue here that we got to solve, right? So if you're feeling stuck, well, statistics show you're not alone. This is very common, right? So why does pain go away quickly for some people, but pain feels like a life sentence for other people, and maybe you're in that group? So first, let's try to understand the root cause, right? Let's talk about that first. What really causes chronic pain? So when we look at common treatments for chronic pain, what we see is that these common treatments are really only set up to mask your symptoms. They're really only there as a short-term pain reliever, okay? They're not addressing the root cause. They might say they are, but when we look at research, you're going to find, and I'll show you in a second, that that's not true. We already talked about this. The medical system sucks at treating chronic pain, right? A lot of it is because insurance is what dictates medical care, right? Doctors can only do what they will get paid for by insurance. And that's not just in the United States. That's in places with universal health care too, because they can only do what they will get reimbursed for by the universal health care. And guess what? Insurance only pays for things like a chiropractor to crack your back, or a physical therapist to do ultrasound or TENS, or show you some core stability exercises, or your doctor to give you medications or injections or surgery, right? That's the stuff that insurance pays for. So they're dictating what care you have available to you. Insurance does not pay for actual lifestyle change, teaching you how to become stronger and more capable in real life, nutrition, how to take care of yourself, sleep, how to get good recovery, meditation, stress relief, accountability. Insurance just doesn't pay for that stuff, right? They don't pay to actually hold you accountable, give you one-on-one attention, give you a lot of time and energy from your healthcare providers, and set you up with a personalized plan that's adapted for your needs and your goals. Insurance doesn't pay for that stuff, right? Even physical therapy, they do exercise, but it's still kind of just short-term pain relief, not lifestyle change. Like core stability, for example, is really just a way of saying, hey, if using your spine, like bending your spine or moving your spine, hurts, then just don't do it. But that's not a long-term strategy, because in real life, eventually you're going to have to use and bend your spine. And if you're just taught never to do that, it's really just not a long-term strategy. The other thing is like posture correction. It's kind of the same thing. They're just distracting you with complicated but easy things, and then hoping that in the meantime, things calm down, and they're hoping that you'll feel better just because of time, right? And we see with research that a weak core does not cause back pain. And we see from other research that core stability exercises or special corrective exercises, they really don't have any special benefit to back pain rehab. In fact, we see that, yes, they do short-term have benefits for people who are in severe pain, but long-term, they really don't have any additional benefit. In fact, sometimes it makes people too tight and overprotective and makes pain worse long-term. Down here are all my references, by the way, in blue, if you see these. We see that posture does not cause pain. Basically, everybody has bad posture, and it doesn't really correlate with who's going to have pain and who won't. What about a short leg? No, research says that everybody has one leg that's shorter than the other. It's not a good predictor of who's going to have chronic pain. Okay, but what about my anterior pelvic tilt? Well, everybody pretty much has an anterior pelvic tilt, right? In women, in pain-free women, 85% of women will have an anterior pelvic tilt, and 75% of pain-free men will have an anterior pelvic tilt. So pretty much everybody has this. It doesn't matter. What about your leg length, your pelvic tilt, your spinal curves, your tight psoas, your weak glutes, your hip hike, your scoliosis, all these things. We have 10 different references here. These are 10 different studies that debunk all of these ideas. These things really don't predict chronic pain. Stop worrying about them. On top of that, we see our clinical practice guidelines, our evidence-based guidelines show that treatments like decompression, TENS, and electrotherapies really don't do anything. They're not recommended because they're not very effective for most people. And then we see that invasive treatments operate under the assumption that a single structure is 100% responsible for your pain, meaning that if you get a nerve ablation or an injection or a surgery, it's assuming that you could blame your pain 100% on a disc herniation. But we know that it's very easy to blame a disc herniation for pain because you can see it on the MRI. It looks scary, but when we look at research, we see that we cannot blame disc herniations for pain, or at least not 100%. It can be a piece of the pie, but not the whole pie. So what we see is that sometimes, in very rare cases, yes, a disc herniation can be blamed, but that's like if we had severe disc herniation with severe nerve root compression and red flag symptoms like partial paralysis of your foot, numbness and tingling in your groin, like you can't feel it after using the restroom, or a new loss of control of your bowel or bladder. These would be obviously things to talk to your doctor about, and potentially some people do need surgery. But these are very rare cases, right? For most people, what we see from dozens of studies, these are all peer-reviewed studies, and we see that most disc herniations heal. In fact, the worse the disc herniation is, the more likely it is to heal, which is very interesting. We see that people who get MRIs too early get freaked out about their MRIs, and then they are 12 times more likely to be pushed into a surgery that they don't need. But even if the disc never heals, it doesn't usually matter. What we see from research is that in pain-free people by the age of 50 years old, 80% will have disc degeneration, 60% will have disc bulges, 36% have disc protrusions, 23% have annular fissures, right? Everybody has some scary looking stuff on their MRI, and it really doesn't predict who's going to have pain because these are all pain-free people and they've got scary looking MRIs. In fact, we see that with disc bulges, if you take your age and add 10, that's the percentage of pain-free people with disc bulges at your age. Super common stuff. Even with nerve compression, it's possible that upwards of 23% of people might have nerve compression and have zero symptoms, no issues. And that's possible because the hole that the nerve goes through in your spine is actually 3 times bigger than the nerve itself. So even if a disc herniation did press on the nerve a little bit, it doesn't squish it, it just pushes it a little outside the way. And people get freaked out about that stuff, and then they get afraid of things like bending their spine and moving their spine. But this results in overprotective muscle guarding, which actually creates more pain. So the fear is creating behaviors and muscle spasms and overprotective guarding that creates more pain than the actual thing on the MRI that you're afraid of in the first place. So it's important to know that bending your spine is not dangerous. You just need to ease into it slowly. Let me give you an example from research. You might have been told that when you bend forward, it makes a disc herniation worse. That is not always true. In fact, for this person with this real MRI, when they bend forward, it actually makes the disc herniation smaller. But when they bend backwards, the disc herniation swells up a little bit more. So for this person, it's the exact opposite, right? But this is not something to be afraid of. This is something to work around with exercise and lifestyle. And we see that even with severe symptoms like foot drop, where you have partial paralysis of the foot, this is a client of ours, Jeff. He did really well. He came to us with foot drop, and he said he had a debilitating disc injury with radiculopathy, and he was a surgical candidate, but he was able to avoid surgery. And he says, I'm practically pain-free, resumed all daily activities, and in many ways, he's stronger than he was prior to the injury after going through our program. The point is, even if you do have some significant things on the MRI that we can blame for some of your pain, we can still get you better in most cases without surgery. So if your doctor has already ruled out red flags and serious conditions, stop stressing out about your MRI, okay? These things are normal. Degeneration, stenosis, scoliosis, spondylolisthesis, all of these things are very, very common, even with some nerve root compression. And certainly things like postural findings, anterior pelvic tilt, a short leg, these things are very common. Don't worry about these things. Okay, so then what does cause pain? Well, what we see from research is that there is no single cause of chronic pain. Pain is multifactorial. Here's actual research looking at this. All these bubbles represent different factors that contribute to chronic pain. The bigger the bubble, the bigger the factor. So if we zoom in on these, we see that there are, tissue injury is, sure, that's part of it. That's one color here. But then we've got things like behavioral and lifestyle factors, contextual factors, biomechanical factors, psychological factors, nociceptive detection and processing, which is like nerve sensitivity, central sensitization, a false alarm system, right? A sensitive alarm system. So these things are a big deal. We've got fear and depression and anxiety. We've got sleep and nutrition. We've got social and economic status. Yes, we have our strength and mobility. We have so many different factors. We can't just blame one thing. Stop trying to blame one thing. Instead, let's use my favorite analogy for chronic pain to understand what causes pain, the cup analogy. So if you have a cup and the cup fills up with too much stuff, the cup overflows. And if the cup overflows, something's got to give, right? And that could result in pain or injury or illness, or you get sick, or you're burnt out, you have a burnout, you have a mental breakdown. Anything could give, right? If you just are dealing with too much stuff in your life. So what is that stuff? Well, it's all in the cup. So it really doesn't matter what's in the cup. If it overflows, it's going to cause an issue for you. So things that could be in the cup, of course, overdoing it physically, doing activity you're not prepared for. That's an obvious one. But then we've got things like stress or work or family obligations or inflammatory junk food that taxes your system, or loss or grief, or a major life event, or moving across the country, or getting fired from your job. These are all things that you have to deal with as a human being. And if you're dealing with too much stuff, then something's going to be an issue. So we need to figure out, what are these things? What's in your cup, right? What does this look like for you? And then we can start to take some of these things out of the cup. And then the next step is, well, let's also build you a bigger cup so you can just deal with more stuff. You can handle more physical activity. You can handle more responsibility at work or in your relationships, whatever the case may be. So that's making yourself physically stronger and more resilient, but also mentally and emotionally more resilient. So we want to do both of those things. We want to take stuff out of the cup and build you a bigger cup, okay? And the way that we build you a bigger cup is, physically, there are some things like increasing your mobility, your endurance, your balance, your motor control, your coordination, making you stronger overall, right? These are physical things. But then building a bigger cup is also feeding yourself good, healthy food that's nutritious, and getting better sleep, getting enough sleep so that you can recharge. That's building a bigger cup so you can handle more stuff. Gratitude, improving your mindset, regulating your nervous system, actually having good strategies to deal with stress, anxiety, depression, fear, grief, loss, trauma. These are all things that could be in the cup or things that could be building you a bigger cup. So we need to address these factors as well. And everybody's going to look a little bit different, but these are just some ideas, right? So then we can handle more stuff without the cup overflowing. So how do we actually take stuff out of the cup and calm things down to get you some pain relief, right? That's the first step. Is right now, cup is too full, you're dealing with too much, of course you're in pain. So how do we get you some pain relief? This is going to be about reducing inflammation, reducing sensitivity, and recalibrating a hypersensitive pain alarm system. So step one to get some pain relief is identify what is in your cup. We already talked about this. Just realize that everybody's going to look a little bit different. Now, one of the, actually, we'll get into this. So step two is proving that movement is safe. Okay. So movement elimination diet. Think about it like an elimination diet. If something was irritating your digestion or causing some kind of symptoms in your body, a lot of times we do an elimination diet where we eliminate all the common allergens, and then we go to a place where we calm things down and reduce your symptoms and get you feeling better. And then we start to gradually reintroduce different food items to see what you can tolerate. Well, it's the same thing with movement. We could do a movement elimination diet where we calm things down. We start with simple exercises that do not flare you up to prove that you're capable and gradually reintroduce movement over time. So the biggest issue that we see by far with every single person that we work with is that they're screwing up the rule of twos. All right, this is the biggest issue. The rule of twos is that if you do too much too fast or too little for too long, you're going to have issues. Okay, if you do too much too fast, you're going to get injured. If you do too little for too long, your body's going to get weak, which means you're more easily injured by basic things. And a lot of times people do too much too fast after a period of babying themselves, and then they really flare things up. So instead, we need to be like Goldilocks and find an appropriate amount of challenge that we're not babying you, but we're not flaring you up, right? So what happens is after your injury, you take time off, you try to let things recharge, but you're really not challenging yourself. Physical therapy just gives you baby exercises, core stability exercises, and stretching. And so you never really regain full normal abilities, right? And then they say, okay, you're good to go. Go back to normal life. And you say, well, I guess I'm clear. You go back to normal life. It's too much too fast because there was no buildup, right? They didn't address full body mobility and strength. You flare things up and then you're back to square one, or maybe even worse off than you were before. You're doing this. You're all over the place, right? You're up, you're down, you're trying to ease into things, but you're not doing things in the right order. You need to do this. You need to go A, B, C, D, E. You cannot skip steps with exercise. If you do this, you're going to minimize your chances of flare-ups. You're going to build much more confidence. You'll overcome your fear of exercise, your fear of bending, and you'll successfully be able to get back to really anything, because we could break any activity into these steps. So step one of the movement elimination diet is eliminating the sensitive activities, right? So let me give you some examples of how we can do this. Well, let's say you have difficulty bending forward. Well, one example would be, let's put you in a very gentle position that allows a gentle amount of posterior pelvic tilt, which is a little bit of spinal flexion. In other words, bending your spine forward, but just a tiny, tiny bit, right? Feet up, breathing peacefully into your belly, teaching your nervous system that it's safe to be in this very gentle version of a bigger thing that you're afraid of. You're afraid maybe of bending forward and picking up your child, or picking up a bag of groceries, or picking up heavy weights. Well, this is a very scaled back version of that, and we're going to use breathing and mindfulness to relax into that and prove to your body that this is a safe place to be. Okay. Another example is then we could progress that into a movement. Now, instead of just passively relaxing into a position and using this kind of like a meditation, but a movement-based or a position-based meditation, so it's like somatic healing. Then example two is, now let's actually make this an active practice where we're actively moving into a slightly bent position, but again, combining it with peaceful breathing, a mindful intention, relaxation, telling yourself that you're safe. So it's another somatic practice where we prove to your body that you are capable of doing something safely that you might have otherwise been afraid of, because we scaled it back so much that you can't possibly fail. Now, if this even sounds too much for you, don't worry. We have other exercises that we would give somebody that are even gentler. And if this seems too easy, great. We can make things harder, but we have to prove to your body that it's safe. Okay. We need to prove it's safe, reduce the fear, gain confidence, and reduce sensitivity. If we can do that, you're going to start feeling better. And then step 3 here is calm the overprotective nervous system. I already touched on that with exercise. There's a lot of overlap. In the chronic pain rehab world, there's basically 2 camps. One camp that says it's all physical, it's all due to a joint or a disc herniation or a nerve or a muscle imbalance or something like that. And then another camp that says, no, it's not physical at all. It's only mental or emotional, or it's only due to depression or fear or anxiety or trauma. The truth is, it's both. They overlap, okay? As you saw, as I showed you some exercise strategies, we combined mindfulness and stress reduction. But the same thing can be true with nervous system regulation, right? So in order to reduce stress and fear around movement, which is, by the way, the second most common issue that we see with everybody we work with, we need to combine both things. So a lot of people will say, oh, well, if it's just in my head, I should go to therapy. And we are big advocates of therapy. Therapy is fantastic. I think everybody should do therapy at some time in their life. But the problem with therapy sometimes it lacks practicality. They don't really oftentimes give you practical things to do in your life to build evidence that you are safe. So you can talk about it all day, and that's great, and you should do that if you feel a need for therapy, but we need to put it into action. So one of the things we do with our clients is we find practical ways to address the fear of hurting yourself. So if you are afraid of bending your spine, then putting yourself in a very gentle version of bending your spine is something that we call graded exposure, which, by the way, we borrow from the therapy world, right? If somebody had some traumatic accident or traumatic incident as a child revolving around clowns, we're not going to suddenly have a clown jump out of a closet and scare them. That's going to re-traumatize them. Instead, we might have them say, hey, can you say the word clown without having a fight or flight response? And then eventually it's like, hey, can I show you a picture of a clown? And would that feel safe? And then we gradually reintroduce things. Same thing with movement. This is a way of regulating your nervous system. This is a more practical way because we are proving that you're capable of doing these things. So if we combine mindful movement plus peaceful breathing, this is a stress reliever for sure. And it's an exercise strategy. We combine them, and it's much more effective than doing either one of them alone. The other thing that we need to do if we're going to try to regulate the nervous system is we need to do fewer things that make you feel like you're in danger, and we need to do more things that make you feel safe. So DIMs are danger in me, things that make you feel like you're in danger. And then SIMs are safety in me. These are things that make you feel safe. So examples are things that you sense, things that you do, things that you say, things you think, places you go, people in your life, and things that are happening in your body. Any of these categories could result in you feeling like you're in danger or feeling safe. So if you say to yourself, oh, or the doctor says, you have degenerative disc disease, that's going to make you feel like you're in danger, like your spine is damaged, and you're going to start overprotecting yourself. You're going to have muscle spasms. You're going to be afraid of exercise. You'll become more sedentary, which results in more pain because now, back to our rule of 2s, you're doing too little for too long. But if we reverse that and we say, well, what if your doctor didn't call it degenerative disc disease and you didn't say that to yourself in your head? Instead, we call it normal age-related changes, which is what it really is. Then you feel, oh, I'm safe. My spine looks just like anybody else my age, right? Then you feel safe, you feel confident exploring movement, you start to get stronger and more capable, improve your mobility and strength and your confidence and your mood. And now you're not in a tailspin of depression and fear and anxiety because of the pain. So now we're able to stop that horrible doom loop that you're in. So When you're in the danger cycle, your muscles are spasming, you're in fear, you're avoiding activity, you're creating more inflammation, your brain is telling you you're unsafe, your behavior changes, you have more pain. But when you're feeling safe, you're able to relax and not have those spasms, feel more confident, retrain your brain for positive aspects of your recovery, and build confidence to get out and live your life and do the activities that you love. So we want to do fewer things that make you feel that you're in danger and do more things that make you feel safe. And that's going to help regulate your nervous system. Okay? All of this is how we calm things down. Then step 2 is build things back up. Build resilience. Bulletproof your back. So as we are building things back up, we're doing this because we want to make this a long-term solution. We want to change your lifestyle so you can take care of yourself long-term, right? So let me give you some examples of why we need to build things up. And we need to look at you like a whole human being, not just a collection of parts. For example, if you want to be able to get down on the ground and play with your children, let's say you had young children. Well, in order to sit down on the ground and get up and down off of the ground and crawl around on the ground, well, you're going to need to be able to squat to pick things up. You maybe lunge to get up and down off of the ground. A bird dog or similar core stability exercises could have a role here. Why? Because this mimics crawling around on the ground or reaching for things when you're on your hands and knees playing with your children. So there's a lot of activities that would mimic the demands of the of things you want to do in your real life. So if you're just doing, core stability exercises and nothing but those, or nothing but a couple of sciatic nerve glides or something like that, that does not prepare your body physically to be able to do the things that you actually want to do in your real life. So we have to prepare you to do these things. So instead of looking at you like, oh, we need to fix your posture or correct your imbalances, what we need to correct or fix is your ability to do the activities or the exercises or movements that prepare you for your real life. Okay, so don't fix posture, fix movement patterns, your ability to explore movement as a human being. Let me give you another example. If, for example, you wanted to get back to golf, what movements would you have to be able to do to safely return to golf? Well, you need to be able to rotate through your spine. You need to be able to hinge at your hips. You need to then eventually progress to hinging at the hips from a standing position, which is scary for a lot of people with back pain. You need to be able to extend and use your glutes. So glute bridges is one step on the road towards golf. It's just one step out of many. And then eventually playing golf, we don't just say, okay, good, I guess you're good to golf now. No. We say, why don't we spend some time working on your short game? Let's just putt. And trust me, if you're a golfer, I promise you need to work on your short game. So let's do that for a while and nothing but putting. And then eventually we work on nothing but putting and chipping. And then eventually we work for a half swing and then a full swing and then 9 holes and then 18 holes. We work up slowly, right? Or another example is if you wanted to run a race, you want to run a 5K or a marathon or something like that. Well, to be able to run, you need to be able to move your spine in any direction because running, your spine is moving and bending and your hips are tilting. We need to be able to walk before we can run. Another graded exposure tip here is instead of just walking, we can try incline walking before running, right? And then we do walk runs and then eventually running and then increase your time. So there's a lot of ways we can ease you back into running, right? And this is how we get clients like Joanna back to actually running, right? This is her at the end of a 5K running with her daughter. And she told us that she's like, this is amazing. I had zero pain during and after the race. It's a miracle. 6 months ago, just putting on a fitted sheet was a stretch. So this is very possible if you just break things down and make it relevant, right? So your exercise plan needs to match your history, your pain, your abilities. And your exercise plan needs to match your tolerance. How much stuff is in your cup? How much exercise can we even give you, right? For some people, they got lots of room. We can challenge them. For the others, their cup is very, very full, and we need to take our time with exercise. And then lastly, your exercise plan needs to match safe pain protocols. You need to know what kind of symptoms are safe to push through and what kind of symptoms are not safe to push through. Because if you push through unsafe symptoms, you're going to hurt yourself. But if you avoid pain at all costs, you're going to be babying yourself. You'll get weaker. You'll never get better. So on top of that, your exercise needs to match your goals, right? And prepare you for the real things in your life that mean something to you. So in our movement elimination diet, really, it's like step 2 is reintroduction of those activities, right? So yeah, we're going to start you off with really easy things, that don't revolve around any equipment. We'll start you off. Yeah, there is a time and a place for things like bird dogs and dead bugs. That's fine. There is a time and a place there, but we have to progress you to more challenging things over time. So for core stability, we could progress from bird dogs to planks to, a bosu single leg type of crunching to, really wild variations of side planks and star pose and, some really cool stuff, right? Or if we wanted to get you back to lifting heavy weights like barbell back squats, well, yeah, there is a time and a place for a dead bug. Why? Because a dead bug literally looks like a squat. It prepares you to get into this position, but safely, where you feel confident. And then eventually, let's take that same position and let's turn it vertical. Let's do body weight squats. Then let's add a little bit of weight, and then let's add a lot of weight. And there's actually a lot of different steps in between here. But I'm just trying to break it down into its component parts. Or if we were trying to do a deadlift, right? We could mimic a deadlift position, legs up the wall. This is actually a relaxing meditative pose, right? No effort at all. Not going to flare you up. Then we say, hey, can you even move your spine? And then we get to a more upright position and then a more active position, and then eventually lifting weights. By the way, loved this image that I found because it's an elderly lady lifting heavy weight with a trap bar deadlift. I love that because you are not fragile. No matter how old you are and no matter how much pain you've been in, you're not fragile. Your body is adaptable and you can get back to normal life, right? Now, this is actually a picture. I did blur this because this took years of work for us to put this progression together to understand and map out literally every exercise the human body can do, every movement your joints can do, from easiest to hardest in every single category. But this is the type of thing that we progress our clients through, where we guide you through a personalized journey of going from easy to medium to hard exercises to build your confidence over time. And then in that process, it's not just about physical resilience, it's also about nervous system resilience. So if you have an overactive pain alarm system, right? Yeah, we all need a pain alarm system to alert us of danger so we don't get hurt. But when you've had pain for too long, that alarm system becomes a false alarm. And it sees like this cute little guy here, and it perceives, it just sees the shadow and it's a monster and it hits the alarm system. Sometimes pain is just a false alarm. With hypersensitivity, with chronic pain, we do have hypersensitivity where people have too much pain that is not indicative of damage. And we don't need to freak out just because there's a little bit of pain, right? This is back to our safe pain protocols. What kind of symptoms are safe? What's not safe? So we need to retrain your brain. And that comes down to, number one, changing your thoughts, understanding what really causes pain, and understanding that hurt does not equal harm necessarily. Number two is we need to calm the nervous system down. Now, there's a lot of different practices that we could do, meditation, mindfulness, breathing, other relaxation techniques, even things like self-massage, not because it fixes your posture, but because self-massage is relaxing. It makes you feel good. It makes you feel safe. And then number three is then build evidence of resilience. Prove that you can do these activities, not just so physically you're tougher and less likely to get injured, but so that your brain and your nervous system believes that it's safe to do these things and allows you to do them without overprotective muscle guarding, which would result, of course, in more pain. So how do we fix chronic pain? Well, number one, we need to learn what really causes pain. Stop worrying about posture, alignment, and disc herniations and the things on your MRI. Everybody's got stuff on their MRI. And as long as your doctor ruled out red flags, those things are just going to stress you out. So understand what is in the cup, take stuff out of the cup, and build a bigger cup. Number two, how to fix chronic pain is how to calm things down and get pain relief. And that's by proving to your body that you can do safe and simple activities, gentle movements, build that confidence, combine that with peaceful nervous system regulating breathing and knowledge and education so that we can build some confidence and reduce your inflammation. And in the meantime, by the way, that's getting better sleep and eating healthier food. We didn't really talk about that that today, but those things matter just as much. And then lastly, number 3 is once we've done that, calm things down, we've got to build things back up to bulletproof your back. We need to prove that you can do the activities that are demanded for your real life and mimic the things that you want to do in your real life. Otherwise, you're never going to be able to return to those activities safely. So we need to understand that there is no quick fix. There is no magic pill. There is no magic exercise. There is no substitute for gradual exposure to full body mobility and strength, nervous system regulation and stress reduction, and consistently doing the work, putting in the effort with a whole person plan, doing the things that you specifically need to do based on your goals, abilities, and history. And then many of you, I know based on this information, I gave you a lot to think about today. Okay. So many of you I know like to figure out things on your own. And if you want to try to solve this puzzle, you've got a lot to work with, all right? But some of you are looking for a personalized plan. Some of you want more guidance. You want support. You want to skip the trial and error. You don't want to treat yourself like a guinea pig. You just want somebody who really can take the time to get to know you and give you a personalized plan and look at you like a whole human being. If that's you and you'd like some support, then I would like to offer you, we have a program. I'm not offering you a spot in our program, but I am offering you a chance to talk with our team to see if you can get some clarity around what you're missing from your rehab, and what you need to do to get better. Okay. So in our Beyond Back Pain Breakthrough Call, you would get a 4 pillars assessment. We'd walk you through your lifestyle, try to get to know you a little bit better, see what you're missing, what is in the cup. That'll help you form clear next steps. What do you need to do about it? What are you missing? Right? And this is going to allow you to start fixing your pain, start getting active again. So normally these calls are 20 minutes. Recently, we've changed that. We want to give you a little bit more time so we can really get to know you and give you strong recommendations and get you really strong clarity around what's going on. So these calls are going to be 45 minutes. And normally we would charge $295 an hour for consultations. But right now these calls are free. So our team is going to take some time to get to know you and get you some clarity so you can start feeling better. And that is whether we want to work together or not, right? Now, if you go ahead and apply for the call, you're going to get on our team. Here's how it's going to work. You'll just pick a time from our calendar, and then there's a few questions we need to ask you to make sure that you're in the right place, because we don't want to waste your time if we don't think we can help you. And then you'll get on a call. After you apply, you'll book your time, right? And you'll jump on a video call. So with one of our team members, they're going to send you out a link. You'll get a text message and an email. So watch your email. And you'll jump on the Zoom call. It'll be a Zoom link. If for some reason you would rather do a phone call, just reply to the text message or email and let us know that you want to do a phone call, and we'll call you instead. That's perfectly fine. And you'll get 45 minutes to really take a deep dive. So on the call, like I said, we'll do a 4 pillars assessment to understand your lifestyle. 4 pillars, by the way, I didn't talk about that in this video. 4 pillars are exercise, nutrition, mental health, and sleep. All right. Those are the things that you have within your control to impact your pain, decrease your pain, and improve your quality of life. Okay. So it's a what's in the cup assessment, right? Then this is going to teach you why you're stuck and help us to give you recommendations on your next steps and get you some clarity so you can get out of pain. So why is this call free? Well, this call is free because this is a real picture of me passed out drunk at the bottom of a staircase because I was numbing my pain and symptoms with alcohol, and I had no other better way to do it. So I went from that to becoming a doctor and helping hundreds of people like you to overcome pain. And I had a lot of help along the way, right? I want to make sure that I give that back. And that's why this call is free. So this call is not for you. I want to be clear. If you are not willing to take responsibility for your health, if your health is not your top priority, if you want somebody else to do all the work for you, if you want overnight results, this actually changed. We used to only work with people in the US or Canada, but now we take calls with people and we work with people all over the world. And then people who don't have low back pain or sciatica, just please realize that's our specialty. This call is for people who have chronic low back pain or sciatica, a recent flare-up of an old condition. Maybe you have a disc bulge or nerve pain or degeneration or scoliosis, spondylolisthesis, retrolisthesis, you name it, right? Stenosis is another really common one. This is for you if you're looking for a long-term solution. If you want to take control of your health, if you want to take the driver's seat, if you're willing to invest in yourself, yes, that means time, energy, and maybe even money, right, to take care of yourself. And we want to just make sure that you have seen a doctor at some point to rule out red flags. And you have, if they've sent you to physical therapy, you're good. Get on the call. Let's get you some clarity. Let's get you feeling better. So there's a button, or if you're watching this on YouTube, then in the description, there's a link that you can click and then you can book a call. But let's talk about some common questions that we get. So what if you've already had surgeries on your back? We've worked with a ton of people who have previous microdiscectomies, laminectomies, even spinal fusions, and they've gotten great results with our recommendations and working with us in our program. Should you send your MRI? You're more than welcome to if you'd like to send your MRI over. But like I said, if you've already seen your doctor and they've already ruled out red flags or they've already sent you to physical therapy, then we know that the things on the MRI are not really going to give you as much information as you think. But if you'd like us to take a quick peek at it, then our team would actually just forward that to me directly. And I'm happy to give the stamp of approval saying, yes, we've worked with people with these same conditions successfully, and we're happy to help you that way. Okay. What if you have other injuries as well? Shoulder pain, neck pain, knee pain, no worries. We're happy to guide you on that stuff as well. We specialize in back pain and sciatica, but chronic pain, because we're looking at you like a whole human being, if we do that, we're going to have a good long-term solution. Where is the link for the Zoom call? We will text and email you. If for some reason you don't see that, check your spam or your junk or your promotions tabs. I guarantee the link is there. Make sure you don't, say stop or anything like that to emails or texts or anything like that, and you'll be sure to get those links. Okay. If in doubt, find one of our emails, reply to it, and we'll make sure that we get you going. Do I take the calls myself? At this time, sometimes I hop on a call, but for the most part, you're going to talk to my team. If you really want to work with me directly, then that's inside the program. My time, my individual effort is reserved towards our clients inside the program, where me and my associate, Dr. Blake, dedicate ourselves to giving an incredible amount of one-on-one time to our clients to design personalized plans. Some people want to know if you can just do a phone call. So if you do, that's not a problem at all. Like I said, when you get a link, when we reach out to you to confirm your appointment, just respond and say, hey, if it's possible, I'd like to do a phone call instead of a video call. Not a big deal. We're happy to do that if you'd like. And then how much time if you did get accepted into our program, or if you were interested in our program, some people want to know a little bit about the program, like how much time does it take? What does it cost? All that kind of stuff. We have a lot of different options. It kind of depends on your situation. So, in general, when we work with people one-on-one, we want to see that you have at least 3 to 7 hours per week of time that you can invest in your health. If you can do that, you can get good results. How do you know if you're a good fit for our program? Well, that's part of the point of the call. You're going to talk to our team, get to know your situation. If we can help you, we'll tell you, and then we can tell you what that looks like. Depending on your situation, it's a little different for each person. If you're not a good fit for our program, or if we don't think we can help you, we're not going to waste your time, right? Our reps are trained to make sure that if we hear certain things about your history, then we're going to point you in a different direction. So don't worry, we got your best interest in mind. We're just here to get you some clarity and make sure that you're going in the right direction, whether that's working with us or going somewhere else. We actually turn away most of the people that apply for our program. We point them in a different direction. So if you have any other questions, that's what the call is for, right? Get on the call, book that now. There's a button below, or if you're on YouTube, there's a link in the description. Book the call. Take control of your health. We need to get off this hamster wheel of trying to endlessly fix our posture, our alignment, of fearing our bodies, fearing our spine, and living afraid of those things, and being sedentary and avoiding activities and getting weaker and more injuries. And then we're on and we're off and we feel a little bit better. So then we try activity and then we flare it up. And then we're just going down this medical rabbit hole of drugs, injections, surgery, nerve ablations, spinal cord stimulators, all kinds of crazy things that we know are not evidence-based for most people. Instead, let's take care of your lifestyle. lifestyle. Let's teach you what you have within your control to impact your health and your pain and get you back to the active life that you deserve to be living. So book that call, and we can't wait to get to know you and help you get feeling better and back to the active life you deserve. We'll talk soon.
I had a slip disc between L4 and L5. I had sciatica.
And one day I just woke up and I could not get out of bed.
I had hurt my back in an exercise class.
I was dealing with pretty extreme sciatic nerve pain.
I was dealing with lower back sciatic pain, pretty extreme, where I was at the point of not walking.
I had a severely herniated disc, and I had been dealing with that pain off and on for 24 years.
When I walked, I was in a wheelchair. My wife pulled me around. I was in terrific pain.
But all I could say to the oncologists and the surgeons and the radiation doctors was, yeah, but my back pain. I mean, it was more important to me than cancer because it was impacting my life that much.
When we are in these situations and we're in so much pain and we become so isolated, it is so helpful to have Dr. Davis there who literally is almost, you could say, on call, because you can write him anytime and tell him about your situation, feedback, questions, ask for help, and you get responses, in the same day or, very quickly. And that's remarkable because, we feel really alone.
You have to be disciplined to do what you need to do. Otherwise, you're not going to get better.
Whenever I came to Dr. Davis and Dr. Blake, they worked with me, educated me in what I needed to do to empower myself. I went on a 30-mile bike ride last week. That's a huge win. I rode bike all day, no back pain, none. The proof's in the pudding. Look at me, I'm better.
It has been more of like a long-term approach. If you're somebody who's like still dealing with this after a significant amount of time and is like plateauing like I was, then this could be like the way out of the prison you found yourself in.
You guys set a bar I wanted and had the will to live, walk, and become myself. And with your guys' guidance in this program that sets the bar high, that you're your own hero, that if you want it, you can have it, but you have to work for it. Even if anyone needs community, everybody here is so amazing. I just can't thank you guys enough. You guys are doing great things and you're worth it.
The immediate difference was the personal attention, the hand holding. I feel like I'm getting emotional over it a little bit, but seriously, I was in a bad place when I came to you, and you truly helped more than anyone in my life, anyone.
Like the specific exercises that you guys gave me and the education on how to handle the pain, it helped me significantly. So I would highly recommend you guys for anybody who's dealing with any kind of nerve pain, lower back pain, sciatica pain. I would highly, as a matter of fact, you guys are the only guys that I would recommend.
It was very helpful in this program was to get on a regular exercise program. I love the program. I think it's great.
So what I learned from this program is you got to move. You got to move. It's the only way. Even a couple days into this program, when I was moving my cat-cows and spinal waves and all that sort of thing, my spine was so happy. I instantly started loosening up. 100%. You got to try it. If you're in pain, you have got to try this program and you have to put in the time.
I used to feel the sciatica so much going down my leg, and the buzzing just got a little bit better and better and better and better. I can walk way farther distances without pain stopping me. I am very happy that I can do full body weightlifting.
What was different about this program, it looked at more than just movement. It is what, healthcare probably should be, in that it takes a look at anything that can impact pain and dysfunction, and they give you a plan. If you're willing to put some time and energy and prioritize getting better, then this program is a good choice.
And it was just really clear that it was correlating with stress. And I had never considered the possibility that your mind could affect your body in that way so clearly. So if you want to know, you're like me and you're like, I can do it, I will do anything, then this is the program.
It was very beneficial. I would say anyone who has any lingering pain would benefit from something like this. Is set up in a way that requires accountability, which is very nice for me. I know I'm checking in weekly and I know someone's following up. If I'm not checking in and if I'm not doing my exercises.
Different in terms of providing a holistic approach that addresses all these issues and addresses it over an arc of time.